Welcome to the Basic Life Support Masterclass. This high-yield multiple-choice question session is designed to help you prepare for exams like NORCET, AIIMS, RRB, ESIC, and DHS. Question 1 addresses the compression rate. According to the 2020 AHA guidelines, what is the recommended chest compression rate for high-quality CPR in adults? The correct answer is C, 100 to 120 compressions per minute. Rates below 100 reduce cardiac output, while rates above 120 can decrease coronary perfusion because the heart does not have enough time to refill. Question 2. Single rescuer child CPR. If you are a lone rescuer performing CPR on a 6-year-old child, what is the correct compression to ventilation ratio? The correct answer is B, 30 to 2. For a single rescuer, the ratio is 30 to 2 for all victims, including adults, children, and infants, excluding newborns. The 15 to 2 ratio is only used for children and infants when 2 rescuers are present. Question 3. Infant pulse check. Where should you palpate for a pulse in an unresponsive infant under 1 year? The correct answer is D, brachial artery. The brachial pulse inside the upper arm is the preferred site for infants because their short, chubby necks make the carotid difficult to find. Question 4. Infant compression depth. What is the recommended depth of chest compressions for an infant? The correct answer is A, at least 1.5 inches or 4 centimeters. Compressions should be at least 1/3 the anterior-posterior diameter of the chest. For children and adults, the depth is at least 2 inches or 5 centimeters. Question 5. AED pad placement. When using an AED on an adult victim, where are the pads typically placed? The correct answer is C, upper right chest and lower left chest. This standard anterolateral placement ensures the current passes through the heart. Question 6. Witnessed collapse. If you witness a child collapse suddenly and you are alone with a mobile phone, what is your first action? The correct answer is B. Call emergency response immediately, get AED, then start CPR. For a witnessed sudden collapse, it is likely cardiac, so activating the emergency response system first is crucial to quickly get an AED. Question 7. Infant choking. What is the primary intervention for a responsive infant with severe airway obstruction or choking? The correct answer is C, 5 back slaps and 5 chest thrusts. Abdominal thrusts are contraindicated in infants. Continue this cycle until the object is expelled or the infant becomes unresponsive. Question 8. Unresponsive choking. If a choking adult becomes unresponsive and you lower them to the floor, what is your next step? The correct answer is B. Start chest compressions immediately. If a choking victim becomes unresponsive, begin CPR immediately, starting with chest compressions. Look for the object each time you open the airway for breaths. Question 9. Child rescue breathing. For a child in respiratory arrest, meaning they have a pulse but absent breathing, what is the correct rescue breathing rate? The correct answer is A, 1 breath every 2 to 3 seconds. The 2020 guidelines updated the rescue breathing rate for children and infants to 20 to 30 breaths per minute. For adults, it remains 1 breath every 6 seconds. Question 10. Opioid overdose. If you suspect an opioid overdose in an unresponsive victim with no normal breathing but a pulse, what medication should be administered in addition to rescue breathing? The correct answer is C, naloxone. Naloxone is an opioid antagonist that can reverse respiratory depression. It should be administered while providing rescue breathing or CPR. Question 11. Advanced airway CPR. Once an advanced airway is in place during 2 rescuer CPR, what is the compression ratio? The correct answer is C, continuous compressions, with 1 breath every 6 seconds. With an advanced airway, compressions should be continuous at 100 to 120 per minute, without pauses for ventilation. Question 12. Minimizing interruptions. To ensure high chest compression fraction, interruptions in chest compressions should be limited to less than what duration? The correct answer is B, 10 seconds. Rescuers must minimize interruptions. Pulse checks, rhythm analysis, and switching compressors should all be accomplished within 10 seconds. Question 13. AED in water. You find a victim lying in a puddle of water, and you have an AED. What is the most appropriate action? The correct answer is B. Move the victim to a dry area and wipe the chest before applying pads. Water conducts electricity and may disperse the shock, preventing it from passing through the heart. Question 14. Agonal breathing. A victim is unresponsive and gasping occasionally. How should you interpret this? The correct answer is B. A sign of cardiac arrest. Start CPR. Agonal gasps are not normal breathing. You must treat this victim as having no breathing and begin CPR immediately. Question 15. Scene safety. What is the absolute first step when arriving at a potential cardiac arrest scene? The correct answer is B. Verify scene safety. Always ensure the scene is safe from hazards before approaching the victim, because the rescuer cannot help if they become a victim. Question 16. Chest recoil. Why is full chest recoil, allowing the chest to return to its normal position, important between compressions? The correct answer is B. It allows the heart to refill with blood. During recoil, negative pressure pulls blood back into the heart, and incomplete recoil reduces blood flow generated by the next compression. Question 17-2. Rescuer infant CPR. Which hand technique is preferred for two rescuer infant CPR? The correct answer is B. The two-thumb encircling hands technique. This technique is preferred with two rescuers because it produces better blood flow pressure and allows the second rescuer to focus on ventilation. Question 18. Gastric inflation. During rescue breathing, you notice the victim's abdomen distending. What is the most likely cause? The correct answer is A. Breaths are given too forcefully or too quickly. Gastric inflation forces air into the stomach instead of the lungs, increasing the risk of vomiting. Question 19. Recovery position. When should the recovery position be used? The correct answer is C. For an unresponsive victim who is breathing normally, the recovery position keeps the airway open and prevents aspiration of vomit, but it should not be used if a spinal injury is suspected. Question 20. Team roles. Which team role is responsible for loudly stating "clear" before a shock is delivered? The correct answer is C. The AED monitor. The person operating the AED ensures safety by ensuring no one is touching the victim and loudly warning "clear" before a shock. Question 21. Pulse check time. What is the maximum amount of time you should spend checking for a pulse? The correct answer is B. 10 seconds. Pulse checks should take at least 5, but no more than 10 seconds. If a pulse is not definitely felt within 10 seconds, assume cardiac arrest and begin chest compressions. Question 22. Pediatric pads. If you have an AED with only adult pads and the victim is a 4-year-old child, what should you do? The correct answer is C. Use the adult pads, ensuring they don't touch. It is better to use adult pads than no AED at all. Use anterior-posterior placement if the pads are too large and risk touching.